Okay, thank you for allowing me to present this present work on HIV and cancer in referral hospital in 4 West African countries. This presentation is made on behalf of our epidemiology consortium, the IeDEA West Africa collaboration. First of all, let me introduce with a little bit of context. Just to say that as of today in sub-Saharan Africa, mortality and morbidity of HIV-infected people are mainly mediated by opportunistic infection. However, with the scale-up of hot chronic conditions such as cancer will soon substantially contribute to the disease burden of Africa living with HIV as already observed in high-resource countries. In addition to that, we know that etiologic factors interacting with HIV infection and leading to the occurrence of cancer are quite different in West Africa compared to other parts of the world. For these reasons, we believe we need to provide an overview of the intersection between cancer and the HIV epidemic in sub-Saharan Africa. So, the objective of this present work was to estimate the association between HIV infection and selected types of cancer among patients hospitalized for malignant condition in 4 West African countries. For this, we conducted a case reference study that was initiated in referral hospital of Abidjan in Côte d'Ivoire, also in Cotonou in Benin, and subsequently extended to Lomé in Togo and to Abuja and Benin City in Nigeria. For those who are not familiar with West Africa, the West Africa region, I've presented this map and pointed out with the red arrows the cities involved in this project. During a 1-year period, each participating clinical ward selected all adult patients seeking care with a confirmed diagnosis of cancer. All patients were proposed, when appropriate, an histological examination supported by the project. All patients, include patients, were individually interviewed to collect socio-demographic as well as behavioral information. And they were all systematically assessed for HIV infection using rapid HIV test. HIV prevalence was reported for selected type of cancer cases. Of course, AIDS-defining cancer, namely KS, non-Hodgkin lymphoma, or invasive cervical cancer, but also a subset of non-AIDS defining cancer, which were known or suspected to be linked with HIV infection. This seroprevalence of HIV was compared to a reference group of cancer, not reported to be associated with HIV infection, and who was constituted of a mixture of mainly digestive cancer as well as prostate and breast cancer. We performed an unconditional logistic model to estimate the association between these selected cancer cases and HIV infection. So let's get to the results. This first table shows the main characteristics of the included patients. A total of 1,644 patients has been enrolled, which there were 184 HIV positive patients diagnosed. They were significantly younger. They were more women, more frequently women. They were also more frequently declaring multiple and a high number of lifetime sexual number of partners. This figure presents the distribution of most reported cancers according to HIV status. The important points to see in this figure is first, when you look at HIV negative patients, the top 3 cancers are breast cancer, cervical cancer, and prostate cancer. These 3 cancers are the cancer also reported from available information from local cancer registries. When we look at HIV positive patients, the top 3 cancers are the AIDS-defining cancer, with cervical cancers as the prior cancer, It's also interesting to note when we look at non-AIDS defining cancer that among HIV-positive patients, anogenital cancer as well as skin cancer are particularly frequent compared to HIV-negative ones. The present table presents the association between AIDS-defining cancer and HIV infection. On the top of the table is presented the overall prevalence in the comparison group, which was 4.4%. And when only looking at women, it was 4.3%. We found a significant and strong association between KS and HIV as expected, with odd ratios over 30, and also a significant association for non-Hodgkin lymphoma and cervical cancer, with odd ratio ranging from 4 to 5. When looking at the association between selected types of non-AIDS defining cancer and HIV infection, we found that cancer of the anogenital organs were significantly and strongly associated with HIV infection, with an odd ratio over 17. We also found a significant association between squamous cell skin cancer and HIV infection, as well as an association with borderline significance between primary liver cancer and HIV infection. So what can we say about these results? First of all, that AIDS-defining cancers are strongly associated with HIV infection and are a leading cause of cancer in West Africa, especially among HIV-positive patients. A significant association is also now reported between HIV infection and non-AIDS defining cancer, including cancer of the anogenital organs and squamous cell skin cancer. These results are concordant with a previous finding from South Africa using approximately the same methodological approach, where they found a significant association with anogenital cancer and squamous cell skin cancer. We also found an association between primary liver cancer and HIV infection. This association is concordant with what has been already reported from linkage studies in high-risk settings, although it has not been reported in sub-Saharan Africa so far. However, there are limitations to these findings. First of all, the sample size, which is quite limited, and also the absence of standardization of the definition of hepatocarcinoma. And lastly, risk factors such as viral hepatitis were not taken into account. So that's why we believed we needed to conduct a dedicated case control study to solve this question. And there's an ongoing project currently running on HIV and hepatocarcinoma in 4 countries in West Africa. So to conclude, this study provides a representative and precise picture of the association between AIDS-defining cancer and HIV infection in West Africa. We found that HPV-related cancer included cervical cancer, but also anogenital cancer and squamous cell skin cancer are reported here as leading cause of malignancies among people living with HIV. As these cancers are amenable, accessible to prevention strategies, screening of HPV-related cancers should be of paramount importance in West Africa among persons living with HIV. Finally, I would like to acknowledge all patients that participated in this project and all the colleagues that made this project feasible, and thank you for all their hard work. Thank you.